Hi, my name is Claude Fortin. I am the co-chair of CanSAGE3. CanSage is the Canadian Society for Advancements of Gynecological Excellence. I'm here today with our first speaker, Dr. Guylaine Lefebvre, who is well known in Canada, and I'd like to welcome her to this meeting. And Guylaine, if you don't mind, to give me a few words about your academic past and your present situation.
Merci, Claude. First of all, congratulations to CanSage for where you've come. 250 people at this meeting today. I think that's spectacular, who all care about excellence in gynecology. It's really inspiring. I'm Guylaine Lefebvre. I'm originally from Valleyfield, but my medical training was in Ottawa and then the Mayo Clinic. I worked in Ottawa for a decade, and then I was recruited to St. Michael's, where I was chief of the department, and I ran a fellowship there for gynae surgery. 3 years ago, I moved to CMPA, and I now work there full-time as Director of Practice Improvement.
Well, first of all, I'd like to congratulate you for your career and welcome to the CMPA. That's a great advantage for us gynecologists to have you as a team player as well. It's going to help us a lot. Could you tell us a little bit about or summarize what you talked about in our first lecture that we had at this meeting today?
Yeah, so there's great synergies between the work of my department at CMPA and practice improvement and what the attendants at this meeting care about, gynae surgery in excellence. Surgeons are overrepresented in CMPA files as compared to medicine, and the CMPA now is putting a lot of attention on helping our members reduce their risk, reducing harm and reducing risk to patients, but at the same time reducing the heartache that comes with it for surgeons. Today I spoke about some of the research that we've done at CMPA, looking back at our files and what we see. And in our files we see that there are injuries that still happen in surgery. They happen mostly abdominopelvic during the dissection, and the patients are found to have a complication, often post-operatively, sometimes even after discharge. Mm-hmm. So we talked about some of the things we can do to minimize those risks.
And of course, I mean, it's always interesting to bring that up at a meeting, but do you feel that this talk can be brought to more people, more gynecologists across Canada, and in order to implement, what your ideas that you're going to bring?
For sure. I think one of the things that resonates in our files is the contributing factors have to do with the team. Mm-hmm. And more we're looking at, it's not just the individual surgeon, it's how the team can help the surgery be the best it can. And so I think it's not even just surgeons, it's surgeons and nurses and trainees and the other people who are in the operating room with us, and for sure. This
is what you see in the future. I
Absolutely.
mean, you probably, well, I hope and I think you probably have plans at the CMPA to get that to most of us, and in some of the small centers, small cities, for those people who don't really go to meetings, basically. So do you feel that, is there any other instruments that let's say the letter that we get from the CMPA to get more people involved?
Yeah, so the CMPA has a website that's accessible to members and non-members alike, where we now have written material, we have perspective articles, we also have some articles on and video or electronic assets that people can watch in the convenience of their own center. Yeah. The Good Practices Guide that has some strength to cover basic principles, and we're happy to come out and see our members locally or regionally at various conferences.
Well, thank you, Guylaine.
It's been a pleasure to be here.
We enjoyed it very much. We're very happy for your future career.
Gynae surgery is very close to my heart.
Thank you very much. I'd like to end this talk with mentioning that we're going to have another meeting in May that's called CUD, Society of Endometriosis and Uterine Disorders. That's going to be held in Montreal in May under the auspices of Professor Philippe Laberge. And I'll invite all the members of CanSage, obviously, and all gynecologists in Canada to attend this excellent meeting to come. Thank you very much.
Thank you.